Hi, I'm Sanjay Sarin, Vice President of Access at FIND, Foundation for Innovative New Diagnostics. COVID-19 has been one of the most transformative events in our history. The pandemic brutally exposed the lack of preparedness of health systems across the world. The speed of development and deployment of the diagnostic tests during the course of the pandemic was nearly unparalleled. I think it was about December 2019 when we started noticing these first cases of suffering from this mysterious illness. And as early as January 2020, the genomic sequence of the virus had already been published. And this was something which really made possible the very rapid development of the PCR tests, which in fact available to the laboratories across the world within a couple of months of the pandemic. The rapid antigen test, that small card test, which all of us are so familiar with and are now even using it in the comfort of our homes, that also became available. In fact, not only available, WHO actually pre-qualified the first rapid antigen test as early as September 2020. And the reason, and to you it might seem that it took still 9 months, for a rapid antigen test to become available. But if you were to compare this with malaria, a disease which all of us are familiar with and something which has been there for centuries, I would say, it has taken 28 years for a malaria rapid test to be WHO pre-qualified. And then we also know the unprecedented speed with which the investments went into establishing sequencing infrastructure, which allowed the detection of the beta and the delta and the Omicron viruses, which we are all so familiar with. However, despite the availability of tests and diagnostic infrastructure at such a massive scale, there are still inequities as far as access to testing is concerned. So FIND did a 10-country survey, and we interviewed nearly 12,000 respondents as a part of this survey. And we were very surprised from the findings of this survey, which indicated that more than 50% of these 12,000 respondents, they said that they actually could not access a diagnostic test when they needed it. Now, there were three main reasons for this. One, there was lack of awareness. Second, there was perhaps lack of availability of the test when it was needed. And the third was affordability. Despite so much effort having gone into ensuring that these tests are made available at an affordable price, there were still large swaths of population which were unable to access the test. Then the other key sort of a challenge which we were exposed to during the course of the pandemic was this very high dependence on procuring diagnostics from a very limited set of manufacturers. Now this was, as everyone knows, this was a pandemic which impacted the developed and the developing countries equally. So all of us were actually dependent on this limited set of manufacturers, and which in some ways exposed the fragility of the supply chains, something which we experienced during the onset of the Delta wave in India, when we had to wait for days at end in order to get access to our PCR test. And all of us know that it was impossible to get admission into a hospital without having a positive test report. So which again points towards the fact that it is very important for the countries to focus on building indigenous capacity for developing and manufacturing diagnostic tests. It is absolutely critical for countries to reduce the dependence on the imports. Then, there was all different kinds of apps which were available. The government was able to test, trace, and isolate. They were able to determine every day. We would see those bulletins which were coming from the state governments as well as from the national government in terms of the number of people which were being diagnosed as positive, the number of beds which were available. So which was, I think, a lot of information which has never been made available for any other public health disease of concern in the past. So overall, I would say that while the pandemic led to an unprecedented loss of lives, there were these strong positives that emerged from the pandemic, ranging from the unprecedented focus on the development and delivery of diagnostics, the manner in which the private sector capacities were utilized, the speed of development of the diagnostic tests, the speed at which the vaccines were made available to large swaths of population, investments in local R&D and manufacturing, and the unprecedented manner in which the digital health or the digital health aspect was leveraged in order to increase access to various amenities is also something which needs to be taken note of. So these, I would say, are some of the lessons which have emerged from the COVID-19 pandemic, and it will be important for the public at large as well as for the policymakers and the decision makers within the governments across the world to learn our lessons and ensure that we are better prepared in case of future pandemics.